So you need a root canal. It's really not as scary as you might think. Let's take a look. Here is your tooth. Notice a large filling in it, new decay around the filling, the nerve chamber, infection in the surrounding bone. This tooth is going to require a root canal treatment, and to help you understand what it is, let me draw out the steps for you. Here is your tooth. This is the part of the tooth that you see in the mouth, and the root structure, which goes up into the surrounding bone. Here is the level of the gum. Now, inside of the tooth, there's a hollow chamber known as the pulp of the tooth. Now, inside that pulp chamber is nerve tissue, and it's what gives the tooth feeling and sensation. Now, at times, if you get a large filling or an area of decay, it gets close to the nerve, what will happen is the nerve can become infected and cause tremendous pain. Or it's possible the nerve may die. This infection will then go out of the end of the root into the surrounding bone, causing an infection in the bone. The body is basically trying to fight off. And you can feel a lot of pressure in the tooth, and sometimes it'll push the tooth down and you'll get a throbbing feeling. So what we do as dentists is we have to somehow get this infection out of there and get rid of all this infected material within the tooth. We make an opening into the tooth, into the nerve chamber here. We allow all this infection to drain out of the tooth into the mouth, and then we've effectively made an opening here from this infection through this area into the mouth, and the pressure should go down. We'll then go in, sterilize and shape the canal in such a way that we can fill it with an inert material, essentially completing the root canal and sealing off the tooth. The problem now is that we have very little tooth structure left here. There's the filling, there's the decay, there's the opening. So what we'll do sometimes is put a post in there, in the center of the tooth, in this space, cement it in place, and then we'll build the tooth up with some filling material, and then perhaps even put a crown on it to give it additional strength. Root canal is now completed. Let's go take a look at your tooth. Here we have the final root canal filling right to the end of the root. At this point, we're going to put the post in the middle of the tooth and built up with some filling material and shaped in to accept a crown. There's the crown, and the tooth is now back into full function and ready for your use.